So do we have Dr. Marian or Dr. Jitendra?
Marian.
Marian, please.
Great.
13.2
session. Repetitive session.
Good evening, judges.
Mike.
My presentation is on utility of Masquerade procedure in globe salvage. Masquerade procedure is an old procedure poorly described in literature, done in extensive eyelid loss, where residual conjunctiva is used to reconstruct posterior lamella and split thickness skin graft is used for anterior lamella. It is usually done in extensive burns and in air blepharon, but the disadvantage is the lid is unstable and you can have lag of thalamus. So this is a case series. The surgical technique is first the lid is split into anterior and posterior, whatever lid remaining is split into anterior and posterior lamella. Then posterior lamella is sutured together with absorbable suture. This is the recipient one ready to accept the skin graft. This is I use full thickness skin graft in this, and the full thickness skin graft is sutured to the bed with the absorbable sutures. In the postoperative period, bolster dressing kept for 1 week, and central 2/3 of the flap is divided at 2 months and form the lid margin. Then assess the corneal status and further flap division at 3 months, retaining the flap at both the canthi in order to prevent the lid malpositions. So this is my first case, 46 years male, presented to us with hot water burns. He had already undergone multiple reconstructions elsewhere and referred for evisceration. On examination, there is a lag of thalamus with a perforated cornea. So he underwent Masquerade procedure and along with penetrating keratoplasty and lensectomy. So postoperatively, this is his postoperative picture, retaining the flap at canthi and the improvement in lag of thalamus, and he has retained his PL vision and improved hand movements. This is my second patient. She is a 7 years female, known case of popliteal terrier syndrome with bilateral eyelid coloboma and total lag of thalamus. With exposure keratopathy in both eyes. Right eye, there is a vascularized corneal opacity. Left eye, there is a perforated corneal ulcer, and this is a total lag of thalamus. She underwent Masquerade procedure. This is a postoperative picture with the flap in situ, and after partial flap division, this is the picture, and at 8 months follow, the left eye has gone to phthisis, right eye the vascularization has improved, but there is a corneal opacity remaining, for which she is awaiting anterior lamellar keratoplasty. So coming to discussion, Masquerade procedure is a historical procedure where the globe salvage is possible where all other measures fail. I have done few modifications in the originally described procedure where full thickness skin graft has been used instead of split thickness skin graft, and sequential flap division with retention of the flap at canthi to prevent lid malpositions. Coming to the literature review, only very few reports are there. The biggest series was used by Liu et al. In 5 cases of burns where he has used full thickness skin graft. In the other series where only 2 patients and they have used full thickness skin graft, they have graft contracture. So Masquerade procedure is a versatile option to rescue the globe and ocular surface in a very challenging situations. These are my references. Thank you.
Questions?
Not my cup of tea.
Any questions, sir? No.
Actually, you presented 2 cases, no?
Yeah.
And how frequently at your center you do that?
How frequently?
At your center you did that?
No, it's very
there
rare.
are more cases or?
No. Only I have done total 3. These
Total
are the
3?
Total
Out
3.
of that 2.
Yeah. This
Right.
is the 2 I have presented.
Thank you, madam.